Hi, everyone. Once again, I'm Dwayne Spencer, President and CEO of Habitat for Humanity of Greater Memphis. As some of you may know, our Health and Housing Summit was originally intended to be held in person. As we shifted to a virtual event due to the inconvenience of COVID, we decided that the summit would be held in January. Once that decision was made, it became really obvious to everyone involved in the planning of this event that inserting a special message that honors the legacy of Dr. Martin Luther King Jr. and his birthday would be a natural fit, knowing that housing equity and equality was something he believed in and fought for. So we decided to bring you a special message that you could watch on your own time and at your leisure. We all know that MLK Day is the only federal holiday designated as a national day of service, a day when Americans are encouraged to volunteer to improve their communities. It's a day on, not a day off. So today we wanted to encourage you to give a little time to consider how Dr. King's message relates to housing and healthy housing's role in addressing health and racial equity. We're calling it the urgency of now. Today, I'm happy to introduce my friend Ruth Norton, President and CEO of Green and Healthy Homes Initiative. For 28 years, Ruth has led the national efforts to eradicate childhood lead poisoning and change the trajectory of families living in under-resourced communities, often undermined by the toxic legacy of lead and unhealthy housing and racially motivated housing disinvestment. As the president and CEO of the Green and Healthy Homes Initiative, she's authored some of the nation's most effective legislation and funding proposals to advance healthy housing, including groundbreaking work to align healthcare funding to repair environmental and safety threats in occupied housing to address the social determinants of health and racial equity. Noted as the architect of Baltimore and Maryland's 99% reduction in childhood lead poisoning, she established the Green and Healthy Homes Initiative as a national effort in 2009 to focus on a holistic housing approach for energy efficiency, health and safety in partnership with the Obama administration and the office of then Vice President Joe Biden. A Robert Wood Johnson Community Health Leader, Weinberg Foundation Fellow, and with numerous honors from organizations ranging from We Act in New York to the Building Performance Institute, Ruth has served on key councils and advisory boards for the EPA, CDC, HUD, as well as state housing agencies and philanthropy. In her career, she has raised over $500 million to advance healthy housing, but has remained focused on the impact of housing conditions on the opportunities for health and equity for every American. So as I considered someone to speak to the issue of health and housing equity, I could think of no better suited person than my friend Ruth Norton.
Thank you, Dwayne. I'm so glad to be here. I cannot count someone as a better human and a better friend than you. And the leadership that you have shown and the resiliency of forward thinking with Habitat of Humanity in Memphis and as a national leader in Habitat. I am grateful to be with you today. I am more grateful to talk about the work of Dr. King and the work that we're doing at the Green and Healthy Homes Initiative to honor his legacy, to put a path forward for every child and every senior living in low-income communities who have suffered from ill-conceived and unjust policies. Our organization, founded in 1986 by 9 parents whose children were in the intensive care unit receiving treatment for lead poisoning at Johns Hopkins Hospital when they lived a block away from the hospital, who turned their vision outward and said that they needed to advance a mission to break the link between unhealthy housing and unhealthy children. Today, the Green and Healthy Homes Initiative sees its vision as advancing health and racial equity and opportunity through healthier housing. So I'm very glad to be here today with you to talk about the core inspiration in my life to work for a fair and just society, and that is Dr. Martin Luther King. And as we celebrate his birthday, what I think we have a unique opportunity in this country to do now, in the midst of COVID, in the midst of racial unrest, and the inflection points that we are facing on racial equity, is to celebrate and put into action his life's work. We talk about the urgency of now because the country today faces so many challenges. We face challenges that aren't new and uncovered only by the pandemic, but that have haunted us for hundreds of years. But the opportunities in front of us to understand that we've asked hundreds of millions of Americans to use their homes as a shield for health, that we have seen the outpouring of calls for justice in the face of George Floyd, Breonna Taylor, and here in Baltimore in the name of Freddie Gray. Young Freddie Gray grew up in housing that poisoned him with lead and left a toxic legacy, not only in his life, but in our community. By the time he was 3 years of age, he had moved multiple times, suffered from asthma, and suffered from lead. His path forward, which came to a tragic end over 5 years ago, reminds us of the opportunity pathways that we set for every child. And it's Dr. King and people like John Lewis and Elijah Cummings who have worked to help us light a path toward a better and more fair future. So I'm very happy to be here today to talk about our work and how that plays into providing better opportunity, better health, and better equity for all. Every night, those of us who work here at the Green and Healthy Homes Initiative and those working on solving the issue and the moral compass of housing condition for under-resourced and low-income Americans, and most especially Black and Brown Americans who have suffered by disinvestment and disenfranchisement through the housing systems. We stay up every night thinking about those 30 million American families who wake up with leaky roofs, with chipping, peeling, flaking lead-based paint, and the impact that is caused by that. The brain damage that happens because of lead poisoning and costs this country over $50 billion a year. Kids who are, and seniors who suffer from asthma. Children who cannot get to the classroom because of asthma being the number one reason for absenteeism every day. And those families who cannot get to work, who suffer from turnover of housing stock and lose wealth every time they have to move, or seniors who cannot pass on a healthy home as part of intergenerational wealth transfer. Those are the issues that we're working to solve every day. And by solving them, to provide opportunity to every community so we can see the full potential and the beauty of the opportunity for everyone to succeed, be healthy, and have a fair shot at equity. If we look at the indirect impacts on unhealthy housing, it goes to things like stability, to wealth accumulation, but it also has big impacts on emotional and mental health and long-term performance and productivity. Opportunities to compete, to learn, and to earn. We know alone from the toxic legacy of lead those impacts. Children and adults who are poisoned by lead will face lifelong impacts that include a greater likelihood of ending up in the juvenile justice system, a 7 times greater likelihood of not graduating in high school. They will earn at least $1 million less than their peers and have a 16 to 19% greater likelihood of cardiac arrest and a 46% increase in early mortality, not to mention low birth weight babies, greater likelihood of hypertension, and many, many other ills that come from this country's toxic legacy of not ending the issue of lead poisoning. But it doesn't stop there. It's housing condition. And where is our moral compass on housing condition? Energy inefficiency, poorly weatherized housing is affecting millions of families every year, driving up costs and leading to destabilization and lower opportunities for health, for education, and for earning. We also know that injuries have some of the highest costs for children and certainly for our seniors. It's the threat of unstable housing, the extreme cold and heat that are faced by seniors that are often forcing them into assisted living or to give up their housing in their later years. And it's that very housing that gives them home and place, social connection, and an opportunity for quality of life. And when we take that away, we also take away the opportunity for that intergenerational wealth transfer, for which the white community has built a long legacy of wealth building and sharing that we have taken away from Black and Brown communities. And we couple that with the eviction cliffs that we're facing right now as a result of the pandemic, utility cutoffs, and already an affordable housing shortage that impacts over 71% of families with extremely low income families having to spend more than 50% of the resources they have just on their rent and utilities, often setting aside food and medication and educational advancement. But there is a better opportunity for us. For every dollar that we invest in lead poisoning prevention, we recover up to $221 for communities and for families. And for asthma, for every dollar that we reduce mold, mildew, moisture, pests, poor indoor air quality, we recover up to $14 for every dollar spent. These are magnificent returns that are coupled and strengthened by making houses more weatherized and more energy efficient. And there's some good stories to tell out of it, including our work in Baltimore and in Maryland in lowering the rates of lead poisoning by 99%. And that 99% reduction, coupled with a 66% reduction in hospitalizations for asthma by addressing the health of housing, Duke University tells us resulted in a $44.5 billion return back to the Maryland economy. But what we know, and what's startling about that figure for me, is that while it may be something for many to celebrate, it caused us to think about, where do those dollars go? Where should they go? And why aren't we doing this kind of work at greater scale? It's why we're calling on the new and incoming administration to spend $100 billion on addressing lead paint, energy inefficiency, lead service lines, improving the stability of housing. Because the money that we earn by doing this has opportunities for great benefits. But what we learned in our reduction of lead in Maryland is all of that benefit did not necessarily go back to communities, did not go back to creating jobs and creating opportunities. So we have really got to focus on those investments. And we have to ensure that as we help seniors, we're helping make a safer place for them to age well, have a quality of life, and that if they choose, they can transfer the value of that home. We have to ensure that when we invest dollars in communities, that we're creating jobs, fair paying jobs, well-paid jobs with benefits. But if we go to repair communities that we have sent into such dire conditions because of how we have put our policies and where we have disinvested, we have to ensure that the opportunities are to create jobs, to create the ownership of companies that work in the communities to solve these issues. We have to think about healthcare investments that can go in to communities and create better social determinants of health that include educational opportunities. We have to think about new ways of scaling that work, and it's what Habitat is doing. You know, as I began my work over 28 years ago, it was because of kids that you see like this, that you see in this picture. I was mentoring a young man at the Franciscan Youth Center here in Baltimore. And I recognized in working with him, playing ping pong in order to induce him to do a little math and do a little reading, that what was in front of him was dire. 3 kids in his family had lead poisoning. He lived in homes that the families continued to move from one house to another because of housing conditions, because his mother might report a lead level and know that it was going to face eviction. Higher crime rates, higher dropout rates, poor housing condition, being cold at night because the heater didn't work. This was something that needed to change and can change. And as we've seen the impact and the root causes of inequities and disparities highlighted by things like the coronavirus tracker, this is not new and it is not news, but it is an opportunity to do something that my friend Elijah Cummings said to me on our first walk through Baltimore together, that we have to change what has become normal for communities. That kids will be poisoned by lead, that they'll have asthma, that grandma won't have heat, because that's the way things are. What Dr. King taught us is the way things can be, that we can stand on that arc and change our trajectory to justice and to opportunity. So I really want to thank and praise Habitat for Humanity, especially my friends in Memphis, for investing in that future, for thinking about a fair and just society that begins at home. So I want to thank you for letting me be here today to share with you my life's work that was inspired in 1968, when in the stark reality of Martin Luther King's assassination, I began to learn about his work and about the opportunity that we can all share in if we just give everyone a fair and equitable start. And for us, that begins at home. So thank you, Dwayne, for having me today to have a conversation and to engage around healthy housing, and to thank everyone who's attended your summit and is attending your summit, to hopefully be inspired by the moment to make change, but to do it now with the urgency of now and at scale, and to never, ever turn back. Thank you.
Ruth Ann, that was wonderful. Thank you so much. If you will give us a few more minutes, I'd love to have a short conversation. So I want to ask, okay, thank you. I'm going to start with a question for you. What do you think are the true lessons of Dr. King that you see that can be applied in the work ahead?
Well, I think, for anyone to be judged by the content of their character, the integrity that they bring, the opportunity to have resilience, we have to ensure that we don't poison children before they can even have an opportunity to read, or an opportunity to learn right? To thrive, to contribute. I think Dr. King really called out for all of us to understand that as human beings on this earth together, the potential of every person should be on full display. And, so I think the lessons that I learned in that very early on was really about the opportunity that each of us bring, sort of the beautiful potential that each of us bring. And I think it has long haunted me that we cut that opportunity off by how we do things like treat neighborhoods and where people live, and not understand that we have to go in deep and really support every community to have that opportunity. And for me, that's the daily legacy. Outside of my office is a picture of Dr. King with his head in his hands that I look at as I walk into my office every day. The other thing I look at every day and I walk into my office is a headline from the Baltimore Sun that says, "The efforts to prevent lead poisoning are doomed to fail." So it's my life's work to prove the Baltimore Sun wrong. And I often find myself turning and looking back at Dr. King before I go past that article. I would like to know from you, Dwayne, what are your inspirations and what has really brought you in your work? How has Dr. King influenced that work?
Yeah, my origin story is one of a Black child growing up in the South. It was pretty normal to be aware of MLK and his contributions to civil rights and how they impacted me directly and my family. I remember I grew up in a house with my grandmother and my mom, and my grandmother had these 4 pictures of men on the living room wall, and she adored all of them. The first was Jesus Christ. The next was JFK. Next was RFK, and the other was MLK. And those are my first memories of these pioneers, of course, and MLK. And as my grandmother was a biracial woman born in 1918, she was acutely aware of who she was. And as a child, she lived with her Black mother, with her white father occupying the house just down the road. And her parents never married, and probably wasn't a good idea in the South at that time. But as is customary, biracial children identify as Black. And my grandmother instilled in me pride in loving myself and knowing who I am, being proud of our mixed race heritage, but knowing that I'm a young Black man, and that alone provided some complications in a world where we were still fighting for equality. I was born in 1967, and that was just like right at the height of the civil rights movement. And I remember as a child of about 6 or 7, my grandmother would play these records of Dr. King's speeches. I don't know if anybody else has ever heard those. And she would listen to his words, and when I listened to them, it would literally make the hair on the back of my neck stand up. I don't know why. It was just something about his oration and the way he said the words, sort of like, as a pastor would if you were at church. And then also maybe the way my grandmother responded. She was often emotional, and I could see then, and it later crystallized with me that what these words meant for her. And as she was living in a world most of her life where she was still fighting for fair and equitable civil rights. And so my first memories of MLK connect to my memories of my grandmother and my childhood, trying to understand just what she was thinking when she heard him speak, how that moved her, and not really fully grasping it. So now, as a man of 53 years old and having led this Habitat affiliate for 19 years, I get to live out my belief, really, that every person deserves an opportunity to create a better life for themselves through home ownership, or with our seniors through decent housing, regardless of circumstance, regardless of color. and or even educational attainment. So I'm very proud of that. Thank you for asking me.
Well, I am in love with your grandmother because so many people that I think we've both seen in our lives who were so touched by Dr. King. I think of Levi
Absolutely.
Watkins, who graduated from Vanderbilt Med School, became the first African American head of cardiology, and Hopkins was one of my dearest friends, who really started to take institutions like Hopkins and open them up for opportunity. Uh,
Hmm.
but so many legacies. But you are clearly one, and the work that is being done. So thank you for sharing that.
Thank you. And I know, Ruth Ann, we both have seen so much in terms of the struggles of the families that we serve who live in under-resourced communities. When I think of my own personal connection to health and housing, about me again, but as a child, living with that grandmother, as I mentioned already, we were very poor, and we lived in a house that was substandard. We didn't have a bathroom. And I have to admit, I only started telling that story about not having a bathroom maybe 5 or 6 years ago because I was embarrassed to talk about it. We had no central heating, no air conditioning. And I remember my mother telling me stories about how she would have to sit up with me at night when I was a toddler because I had bronchitis and I had all these issues breathing. And so I am pretty sure that that house, which was our refuge, but it was making me sick. I'm sure it had mold and mildew. We probably had lead issues. So, those poor housing conditions certainly had an impact on my health, on my well-being, something I had never really thought much about until I started working in this space here at Habitat, and the impact of our work on seniors, and understanding how a house can literally make you sick. And that was happening to me as a child. I remember we had an opportunity to move out of that substandard house, and there was some sort of government program that my grandmother was applying to, and they were going to build us a new house, and we were so excited about that. However, before the construction started, there was some rule that had something to do with who could live in the house. And I don't know what it was to this day, but it changed everything. And my grandmother decided that nope, if her family could not live with her, she would just live in that old substandard dilapidated house, and that is where we continued to live until 1983 when the house burned down. And so our circumstances were not changed by anything we did intentionally. It was just fate. And so when I started working at Habitat in 2001, I never had really given any real thought to the fact that our work at Habitat was having an impact on our new home buyers' health. I mean, it never really crossed my mind. I never even heard of the term social determinants of health.
Right.
But ultimately, I have gained that very real perspective, and I now fully understand that where you live can make you sick. And we've now made it our goal to highlight it and work to address it in our work every day. So,
Well, yeah, if you think about every family who today is at home and captured in their home because of COVID, just the
yes.
dosing of what is happening around asthma, around indoor air quality, around, I have so many conversations with health directors around the country to talk about the fact that kids aren't going to their well baby visits, right? So out of that, not only are kids not getting vaccinated for other things, but
Right.
not testing them for lead, and lead testing has gone through the floor. But in many of those states, when they see a lead poisoned child now, the rates are so much higher. Or when the emergency housing need is so much greater because we're not investing right now.
Right.
But which I think about so much about the urgency of this. But when you were telling your story, I was thinking about the feeling of being ashamed to tell a story and what people feel about their homes, about being ashamed of their conditions, but also knowing that's their home.
Mm-hmm.
I did work in the East Baltimore community when we were doing a redevelopment of an entire community in East Baltimore. And there was a pre-survey before there was going to be demolition and rebuild that the Annie E. Casey Foundation helped to lead for rebirth in this community. And in a community where literally there were no ceilings, no roofs sometimes, no floors, people would answer the door. And of course, they told the people taking the survey, when they were asked how they viewed the condition of their home, over
Mm.
70% of the families said good to excellent,
Mm.
because they did not want people to know
Yeah.
what they were suffering with. This is our burden and our opportunity to do something incredibly transformational and tangible now, to change that so that there isn't a next generation of kids who think that way, or of seniors who, when you displace a senior, they literally die at a greater rate, faster. Um,
Mm.
Even if you're thinking that you're helping them to go to assisted living, rather than if they can live healthy in their own home. But
Absolutely.
the stories of this, are compelling, and the fact that you feel that and have dedicated your life to what you're doing, I think it makes it all the more powerful. And I want to just,
Well, thank you.
I
It
can
took
tell
me 15 years to get there. Uh, I just,
yeah.
I realized after asking our homeowners, which we do all the time, to do testimonials as we do fundraising, and I realized that I had a story that I also needed to tell, and it was freeing. And I share it more freely and more openly than ever before, because I think it's important. But so for you, Ruth Ann, what stays with you as you work to turn the country's understanding of how healthier housing can move us from disparities to equity?
So my biggest psychic income in life, right, is I love to fix things. I'm a fixer. Sometimes it doesn't make me the great friend who wants to fix everybody's problems, but I like to fix things.
Yeah.
But I find the most unbelievable and clearly selfish joy when I see young kids grow up and do magnificent things and thrive. And I just love learners, and I love people who do innovative and creative things. And what stays with me are those times when I meet families whose kids have enormous brain damage,
Mm-hmm.
and the pain that that brings. That even for families who didn't put the lead paint on the wall and could only afford the home that was never kept up, or got behind because their husband died, and an older widows who have watched their house go down in disrepair, and
Yeah.
that stays with you. But what also stays with you is when we're able to change that. I
Mm-hmm.
think about kids literally that we've helped to reduce asthma and asthmagens in their homes. And sure, they don't go to the hospital anymore. They don't go to the emergency room. We save Medicaid tens of millions of dollars, right? But, or, in large part. But I think about the fact that that kid can go play basketball with his brother or sister, can sleep through the night and wake up with opportunity.
Mm-hmm.
Kids not getting in the classroom is the breaking point, a major breaking point around equity, around self-worth, around resilience. And I feel like I got blessed with one thing, which is resilience. And so I wake up in the morning happy and hopeful. And I know that in part comes from privilege, it in part comes from good health, right? It comes from knowing that there's opportunity. But thinking about the trauma that unhealthy, and which leads to unsafe housing for families, it's draining, it's exhausting. The ability to change that
Hmm.
is and be a part of that change is a completely selfish joy. Um, and the ability to see things change and understand how systems work more and more about how to fix them. And then I think the last thing that really keeps me going is the power of young people who are part of innovations to help seniors
Hmm.
who think about better ways for us to do things, who are thinking about climate justice and housing and how things are connected. Um, but it's all about fair play for me, and all about everybody gets a level, should have a level playing field. Um, and so the original premise of that young man that I mentored at the Franciscan Youth Center, the ability to try to get him or his peers into the classroom, healthy, ready to learn, to
Hmm.
compete, to thrive, and to earn, um, is a justice that was brought on for me by King and by Bobby Kennedy, who I wrote my senior thesis in college about. Um,
That does not surprise me.
I, so the RFK, the MLK, right?
That's right.
Um, but I'm excited about where we go, and we are in terrible times, right?
Hmm.
We're sitting with crazy things happening in our capital, with a divided country, with a pandemic, and challenges that are as great, I think, as this country has ever faced. But out of it is the opportunity to build the vision of King and build the vision of the current generation. But generations like your grandmother who knew better, they knew there was something better,
Right.
had a commitment to family, but knew there was something better and more just. And we have never had a better time than now for that. And we have seen that we can act at scale. And we know what justice is. In our hearts, we know what common sense is. We need the courage of common sense. You know, you and I know we love each other, right? There's nothing in the world we wouldn't do for each other in a heartbeat. Don't see each other too much. Our skin color doesn't matter to us. What the reasons we love each other is the things that we do in life, and the values we share and the opportunities that we share to bring more people to that.
Hmm.
It begins at home. It begins with a roof that is a real roof that is healthy and stable over a kid's head. That where somebody lays their head down at night, they know they'll wake up in the morning, and they
Hmm.
won't be sick because of where they are. This is a simple premise that all of us and everybody who's watching this summit, and the maybe one person who might spend the time watching this,
Yeah.
it's the power that we have, and we have to do it now.
I love that you said that. It's like being in communion. So my next point is that we are from similar organizations, right? Two nonprofits that are dedicated to bringing about positive change, by improved housing conditions, with many of our clients being people of color, in
Yep.
particular African American. Baltimore, Memphis, very similar population, so it's not a surprise.
Detroit, Philadelphia, we could go on down
Absolutely,
the list, right?
that's right. So in that regard, I want to talk about racial equity. I'm going to share a little bit, and then I want to ask you about racial equity. So it's easier done by like telling a story about racial equity. So I was doing a little research before we got on, and so it goes like this. Imagine two neighborhoods. In one neighborhood is a family of four. We'll call them the Franklins. The Franklin's neighborhood is stagnating with abandoned homes, cracked sidewalks, poor schools, over policing because of high crime rates. Most of their neighbors, including themselves, are people of color. In the adjoining neighborhood is a family of three, the Smiths. The Smiths neighborhood has plenty of fresh food markets, parks and green spaces, and good schools. Families flock there because of all these services and how they translate into economic opportunity and good health. Makes sense. But most of the families who live in this neighborhood, including the Smiths, are white. And so the racial composition of these neighborhoods don't just happen on their own. Who lives in which neighborhood and whether that neighborhood has decent housing, good schools, and nearby well-paying jobs is determined by multiple institutional policies and practices. Whether they're intentional or not, these policies and practices have often discriminated by race, which is why we see so much difference in life outcomes based on race. And, one of the big struggles we have here at Habitat and as an affordable housing provider is that many times when we seek government funding that helps sustain our work, it is specifically dedicated and allocated to those communities where there are a multitude of existing issues. And I get that. The government is directing funds to where it's needed the most. That makes sense. But as you had mentioned already, if dollars for decent affordable housing aren't coupled with efforts to curb crime, to improve educational attainment, eliminate the food deserts, and sort of a whole host of other investments, then the efforts for these mostly African American communities, they're just not holistic, and then they're just not sufficient to bring about positive community change that we hope to see. And in my research, Ruth Ann, I found like this definition of racial equity, and it says, we achieve racial equity when race no longer determines one's socioeconomic outcomes, when everyone has what they need to thrive, no matter where they live. And as a process, we apply racial equity when those most impacted by structural racial inequity are meaningfully involved in the creation and implementation of the policies and practices that impact their lives. We achieve racial equity when people, including people of color, that when they're owners, they're the planners, they're the decision makers in the systems that govern their lives. And we achieve it when we acknowledge and account for past and current inequities and provide all people, and especially those most impacted by racial inequities, the infrastructure that they need to thrive. Everyone benefits from the most just, equitable system. And so if you want to respond to that, what are your thoughts about advancing racial equity, especially when it comes to housing?
I could go on for hours about
Of course.
About this, right? I think about this work I've done on lead that led us to doing more holistic housing. That
Mm-hmm.
we knew lead was killing babies and having brain damaging kids,
Impacts. Mm-hmm.
families forever, right? We've known it back to the time Beethoven died, the Shang Dynasty, right? Ben Franklin wrote letters about it. Yet in this country in 1921, under the influence of lobbyists, we were the only country in the world not to sign the ban on lead-based paint put forth by the League of Nations, the precursor of the United Nations. But what I think just was so telling and such a good example of housing policies. In 1937, there was put out a uniform kind of call for housing policy in the United States to go kind of uniformly across the country. And in 1938, the United States of America, knowing that lead-based paint was toxic and actually caused, at the time, people to die from it, mandated the use of lead-based paint in low-income housing. That's a death knell to opportunity. But we could go through hundreds and hundreds of these, right? We could, I've always been haunted in my life. When I was in the 5th grade, one of my best friends was a young girl. Her name was Charlene Ray, and I wanted to have a sleepover. And of course, I wanted my best friend Charlene to come. My parents were like, that was great and that was fine. But the numbers of families who wouldn't let their other little girls come to my pajama party because my best friend was coming, my good friend was coming. And, there's lots of instances here. I know that I've made my own pretty bad mistakes at times in my life and have gotten up, dusted myself off, and moved forward. And I understand that in large part, I was able to do that because of the color of my skin. But as we peel back time and again, the policies, the way we invest,
Yes.
budgets matter. How we make our budgets, right? They say everything about what we care about. How we spend our money. The incrementalism of do a little bit instead of doing what it takes.
Yeah.
We will judge ourselves in this time as to whether or not we finally, once and for all, do what we know it takes to level the playing field, to improve where people live and how they move forward. We have every health system in America driving to advance social determinants of health, to improve health outcomes, that people shouldn't go in the hospital, but they should be able to get to school, to go to work, to achieve, right? None of that changes entirely until we say we have to put money, investment, and policy to the level that we know it is needed and not shy away from what that is. And I have to give very good credit to a friend of mine. We're working on a project in East Baltimore who's at a big anchor institution university. And we are asking them to join with us in a very large investment. And we had put in a proposal and she sent it back to me and she said, tell me the truth about what you really need. This clearly is not enough. It told me that people are changing the way they think. And that's a young female African American lawyer who's working on economic development for this institution. The change of having her in the chair is changing the conversation about what is real.
Definitely.
Because she has seen that in her life, has lived it, has experienced it. Jocelyn Elders, the former Surgeon General of the United States, gave a talk one time, and so I'm sure she may have been quoting herself or someone else, but she said, you cannot lead where you will not go. We need to go to the places of greatest need and make the investments to lift on so many levels. But until we ensure that, in my book, right, every kid gets in the classroom healthy and ready to learn, that they have the assets to allow that we equip African American and Latina homeowners, the ability to maintain housing and their community to be strong and vibrant so they have that wealth generation that happens. It is common sense, and it should be our moral compass, that if we both have an opportunity to thrive, we're going to be better off and we're going to take each other forward. And now is the time to move forward. And I may be 7 years older than you, that I found out today, right? But we got a lot of gas left in the tanks, right, to help do that with generations behind us and ahead of us. But it's now. It is far past time that the legacy of Dr. King is what prevails in this country. And the thought and innovation of so many who are coming up behind us, whether it's climate, whether it's housing, whether it's health, we have to invest at scale and we have to not shy away. It's just,
Amen.
that's the justice that we need.
Indeed.
I think we're good if we do that. So let's go do it.
I think, yeah, one other, let's see, we have one other. No worries.
No, that's it. I think I wanted to talk about what it's like to be a Memphian. This is a little bit out of order for your folks on the tape, but you know what it is like to be a Memphian, where the place where Dr. King died.
Yeah.
And that changed so much about cities. Not for the good, because we turned away from the Black and brown community instead of embracing and lifting the Black and brown community at that time and as a country. But I just would be curious to know that.
Well, I think the first thing is that I think people today probably have a limited view of Dr. King's legacy. So we sometimes, in recognizing his abundance of efforts for civil rights, we overlook the fact that he was very much committed to the working poor and economics. Yeah, and their economic status. And he came to Memphis not once but twice. And he was doing that to stand with sanitation workers and help them vie for better working conditions. I think a couple had died. They've been literally smashed by the equipment. And so he did have a significant commitment to economic justice. And sometimes we have to remind ourselves that the full name of the 1963 March on Washington was actually the March on Washington for Jobs and Freedom. Mm-hmm. And so he was fighting for decent jobs, for fair wages. And that was with an emphasis, of course, for, Black and brown people. And so today, economic gains for, we know low-income families have been thwarted. There hasn't been a lot of upward mobility, and it's really been for folks in the middle class, rich middle class. And so our work at Habitat just remains solidly focused on low-income families, on increasing their economic prosperity, helping them build wealth, providing them the tools, the resources, and the opportunity to purchase a home for the first time and to begin to create wealth for themselves and their families. So that's where we are. And Ruth Ann, this was great. I really enjoyed this. Thank you
I missed you, my friend. Glad to be with you. I'm so glad the summit is such a success.
Thank you. Thank you for taking this time.
You know what? Memphis is my other home. And thanks to good people like you and my friends at Methodist Levanter and the city, my good friend Paul Young and others, Memphis is a home for me. So thank you for always helping me feel at home, even if we're online, right? And,
absolutely.
I guess we can pretend to be anywhere if we're online. So we're everywhere.
I can change my background to be on the beach, right?
Yeah, you're good at that. I can't do it. So, well, let's get back to work and let's go do some good.
Ruth Ann, thank you. I'm just going to close it with a couple of comments here.
Okay.
Dr. Martin Luther King popularized the notion of the beloved community. He envisioned the beloved community as a society based on justice, equal opportunity, and love of one's fellow human beings. And we can realize Dr. King's dream, but to get there, America will need to deal successfully with unresolved issues of class and race and socioeconomic status. So in King's words, I will close, the end is resolution. The end is redemption. The end is the creation of the beloved community. It is this type of spirit and this type of love that can transform opponents into friends. It is this type of understanding goodwill that will transform the deep gloom of the old age into the exuberant gladness of the new age. And it is this love which will bring about miracles in the hearts of men. Ruth Ann, thank you for being with us. And thanks for everyone who decides to watch this. Happy MLK Day. God bless everyone. And thank you so much.